Moisturize, moisturize, moisturize. This is the first step. This is going to help in prevention of your stretch mark to a greater extent. I have noticed in my practices, postpartum women lag behind with their nutrition. Iron levels, if they are low, that's a major cause for hair fall in the postpartum period.
So what are some things that you can do that are safe and recommended for breastfeeding women?
There's one brand in India that's Rinie. It becomes easier for all pregnant women just to visit one website, and they know that all the products are pregnancy and breastfeeding safe. So they don't really need to check the ingredients in every product they buy. Retinoids, either topical or oral, has to be avoided. Strict no-no to be used in pregnancy. Studies have said that they have caused birth defect in the fetus.
Hello and welcome to another episode of the Modern Indian Parent Podcast, the podcast that is redefining parenting in Indian families. I am Rinie Gupta, a pediatric sleep consultant and the co-host of this show. And this is the third episode of our very special Mom Bod series. So the month of September is dedicated to the Mom Bod series, which is a collection of 4 episodes to help you celebrate the incredible bodies that we have after giving birth and also learn about how to become stronger, fitter, and even more beautiful than you already are. In the first episode of this series, the co-hosts Sanchita and I discussed what an emotional journey women go through when they're also undergoing these massive physical changes during pregnancy and after giving birth, and what is it that you can do to really embrace this new body that you are now living in. In the second episode, we interviewed Ankita Sahni, the founder of the Mama Beef It program, to talk about what is it that you can do immediately after giving birth to start strengthening your body. We discussed things like diastasis recti, also known as the mommy pooch, urinary incontinence, and many other challenges that women face right after they give birth. In the next week's episode, we're going to be talking to Nathan Johnson, who is a world-renowned fat and weight loss coach in the South Asian community, who's going to teach you all about how you can lose the weight that you have gained during pregnancy without giving up on the foods that you love. And what is this episode all about? It is about discussing the skin and hair concerns that women are facing during pregnancy and afterwards. I'm talking stretch marks, hyperpigmentation, acne, hair fall, and so much more. We are going to get to the root of why these things are happening to our bodies and how is it that we can minimize their impact so that we can continue to feel confident and feel good in our bodies. This episode is brought in collaboration with Rinie, India's first and one and only gynecologist-approved skincare brand that is specifically designed for women who are pregnant and breastfeeding. And in this episode, we're going to get all your hair and skincare concerns answered by an actual gynecologist. We have invited Dr. Chandni Sehgal, who is an MBBS and MS OBGYN. She has been practicing for over 16 years at this point, and she is a new mom herself. So she not only has all the clinical knowledge to tell us exactly what's happening to our bodies, but she has also very recently gone through these experiences. So stay tuned till the end of this episode if you're interested to know more about stretch marks, hyperpigmentation, acne, hair loss, and so many other things so that you can start to feel more comfortable and beautiful in your mom bod. So let's get started. Hello and welcome, Dr. Chandni. Welcome to the Modern Indian Parent Podcast. How are you doing today?
I'm doing good, Rinie. How are you?
I'm doing fantastic. I'm so glad to connect with you for this episode. This is a very special episode because it's not like all the other episodes. This is a part of our Mom Bod series in which we are celebrating the wonderful bodies that have enabled us to become mothers, but we're also learning about how to be fitter, healthier, even more beautiful versions of ourselves. And this particular episode, like I said, told the audience is even more special because, see, when we're talking about the mom bod, we're always thinking about weight loss. We're thinking about how to lose the inches, how to get back the strength. But a lot of women are also struggling with skin and hair concerns during pregnancy and after. So today I'm going to talk to you about all these concerns that I myself have faced, I have seen my friends face, and I'm telling you, you are surely must have encountered these cases in your clinical practice as well.
Hi, Rinie. Thank you for, inviting me on this podcast on Mom Bod. I'm very delighted to be a part of this.
The first thing that I want to talk to you about is stretch marks. Okay. And this is something that is so close to my heart because, one of the reasons I didn't get a pre-pregnancy photo shoot done, even though that is something that I had always imagined, is because I had the most terrible stretch marks. Now I'm at peace with it, but back then I was just like, oh my God, like it looks like I've got these tiger stripes on my tummy. And at that time I was seeing like pictures of all these photo shoots of like celebrities and everything. I'm just like, why do they have like no stretch marks? And why do I have stretch marks? Have I done something wrong? Like, should I have done something differently to prevent it? So as a doctor, can you tell us that when it comes to stretch marks, how much of it is because of your genetics and how much of it is because of some care routine that you did or did not follow?
Yes, it's a very, very common complaint for pregnant mothers. Most of my patients complain about this. Also, the one of the most common complaint is itching in the belly. And this is because of the, skin stretching during pregnancy. As the pregnancy progresses, your belly expands, your skin stretches. And as your skin stretches, the elastin and the collagen fibers tear, and that leads to the formation of stretch marks. Second is hormonal changes. This also makes your skin very sensitive, very reactive. So the cortisol hormone is significantly higher in pregnant women, and this reduces the ability of the skin to make elastic fibers and making it more prone to tear and formation of stretch marks. It's a natural maternal adaptation to pregnancy, I would say. You should not be, very bothered about it. It's a normal thing. And as you said, tiger stripes, your body has created a new human being. So you should actually embrace this experience, celebrate your body. And as for your question that is it genetic? There is a genetic angle, but definitely there are ways to, reduce the severity and appearance of the stretch marks with the right care.
Tell me in terms of the treatments that are available, because, when you go out now into the market or you look at Instagram, there are oils, creams, belly butters. I even see belly masks now, those like face masks that now you get those for the belly. So what's the best treatment or product that you should be investing in to reduce the appearance of the stretch marks?
So see, for prevention, there are a few things you need to consider. First step is to moisturize your skin. Moisturize, moisturize, moisturize. This is the first step. This is going to help in prevention of your stretch mark to a greater extent. Use thick oils, creams that has cocoa butter, shea butter. You can use almond oil. You can use coconut oil, olive oil, vitamin E oil. Even hyaluronic acid is one ingredient that is safe in pregnancy, and it gives a lot of hydration. So you can use products that has hyaluronic acid in it as well. Thing I would mention is start early. It's not like when you develop that itchy belly, you should start moisturizing. You should start moisturizing as early as first trimester. It's not like once or twice in a day, as most of the people say. You can moisturize as soon as you feel that urge to itch or you feel dry out there. You should moisturize your skin. That's a very, very important tip to be followed. You should include skin massages during pregnancy, regular, gentle, circular massages every day for 5 to 10 minutes. It's very important because it helps with boosting circulation and also helps with preventing those stretch marks by promoting elasticity. Second is to not itch. When you have that itchy belly, you have that urge to itch all the time. But when you itch, that leads to more breaking of those elastin and collagen fibers and then more stretch marks. And thirdly, you have to eat skin-friendly foods, I would say. First is protein-rich diet. You need to include eggs, lentils, lean meats, vitamin C fruits that have like kiwi, oranges, help with your skin elasticity. Even berries, you should consume berries while you're pregnant. They are very good for your body, your skin. They boost collagen growth. Also, you need to understand you need to be well hydrated in pregnancy. You need to take 2 to 3 liters of water daily because a well hydrated skin is it increases the elasticity of the skin, and thereby it reduces the formation of stretch marks by tearing of the fibers. So these are a few tips you should inculcate in your pregnancy journey to prevent these formation of stretch marks and also increase the elasticity of your skin.
That is really great to know. I think when you really go back to the science of it and you understand why you are doing certain things, everything from what you're putting on the outside to what you're putting inside your body and how that can prevent stretch marks, that is more likely to stick in our brains. Somebody just telling like, do this, do that. It's like, why? But now that you're explaining about the elasticity of the skin, the collagen fibers, and maintaining the elasticity through all these methods, it makes a lot more sense. And with the belly massages, I feel like I have the fondest memories in my pregnancy because every single day I used to get my husband to massage my belly with some kind of oil. And that was also, it was such a bonding experience as well. So I would really encourage moms to do that. Stretch marks can appear in other parts of the body as well because of the weight gain. It could appear on the thighs, the legs, arms, everywhere. Would you say the same treatment would apply to other body parts as well?
Yes, yes. See, it's a very common myth in pregnancy that you need to eat for two. So you'll meet a lot of pregnant women who will eat a lot and they'll end up gaining a lot of weight in pregnancy. Your optimal weight gain in pregnancy is around 10 to 12 kgs. And when you gain this weight quite quickly, this rapid stretching of the skin, it can happen anywhere. It's not only, we are just talking about the belly because the itching in the belly came up, but it can happen in any part, like your thighs, your buttocks, your arms, anywhere you can develop those stretch marks because of the same pathology. This stretching of the skin, rapid stretching of the skin leading to the curing of the elastin and the collagen fiber and thereby formation of stretch marks.
I think it's the rapid weight gain, right? Because it's like you're right. If you're able to keep your weight gain slow and steady and we gain just about 10 to 12 kgs, and your body will have time to adapt to it. But somebody like me, I put on like 25 kgs because this is what I was told by my family that, like, oh, you have to eat for two. And then they were sending me panjiris and this. They were like, oh, this is going to help you prepare for birth. So we were having all these like very high sugar foods. That's a very important point that you have mentioned here, that it's not just about genetics. It's not just about skincare. It's also about your weight gain and how steadily you manage it that can impact what is the extent of stretch marks you get around your belly and all around your body. But I think, alas, what happens is that even if you may be taking care of it, because the genetic component, it's possible that you may still end up with stretch marks like me, like I did, right? So is there a way to treat the stretch marks or reduce their appearance after pregnancy as well?
Yeah. So if you're genetically prone, then of course you're going to develop those stretch marks. Like your mother or your sister have had stretch marks during their pregnancy. So you are likely more prone to developing stretch marks. You really can't do much about it, right? And as far as the treatments are concerned, like, yes, of course, first of all, I've mentioned that stretch marks are not life threatening. You do not need any kind of treatment for those. But then there are a lot of women who are very, very bothered about their appearance and they do not like them on their skin, right? And they want to get them removed or lightened, I would say. And I would really like to mention that there are a lot of creams in the market that claim, that they can make your stretch marks disappear like this. That's completely a myth. No cream, no oil can miraculously make your stretch marks disappear. Okay, they can, of course, lighten them, but they cannot make them disappear. But if you want to lighten them to a greater extent, there are other treatments available which has to be done postpartum after you've delivered. Then that's safe, like laser, retinoids you can consider, microneedling. These are some ways you can opt for to lighten your stretch marks to a greater extent. For that, you really need to consult a dermatologist. But yes, they are safe only after delivery.
Absolutely. So you will need like professional support. Any creams that are like claiming they make the stretch mark disappear, that's most likely a false claim. I have definitely fallen to those claims. Thank you for sharing all these like various factors that impact stretch marks. And I think moms, if they have this in mind, they will be kind of like more conscientious of the choices they make during pregnancy as well. I would love to shift the discussion to talk about this other thing, which is hair fall. And I feel Instagram at this point is flooded with content about postpartum hair fall, baby hair formation that you get after having a baby. But I just cannot understand, why is it that after giving birth, your hair starts to fall? Like, what's the link between giving birth and hair fall?
Again, this question is a very, very common, I would say 100% of pregnant women, delivery, they have this complaint that my hair is falling too much. They are always so worried about it. So we really need to understand the reality behind this postpartum hair fall. Why does this happen? This is because when you're pregnant, your estrogen levels are very high. Okay, so this high elevated levels of estrogen let your hair be in the growing phase. They do not fall. They stay in the growing phase. So you might have noticed a lot of women also feel that my hair is thicker, fuller during pregnancy. Now, after delivery, when these levels of estrogen go down, the hair that was in the growing stage that was stopped over there, now they start shedding. Since the elevated levels that were, maintaining the hair in the growing phase have gone down, there's nothing to maintain the hair in the growing phase. So those hair fall and we experience postpartum hair fall. But yes, there's also I would say there's ways to reduce the, extensive shedding and also promote healthier regrowth of the hair with the right care.
So, what are some things that you can do in terms of hair treatments that are safe and recommended for breastfeeding women as well?
The first very important thing I have noticed in my practice is postpartum women lag behind with their nutrition. Iron levels, if they are low, that's a major cause for hair fall in the postpartum period. Vitamin D, it's very, very important for your follicle cycling. Zinc is very important. Vitamin B7, biotin, that is very important for the follicular growth. Okay, so nutrition is very, very important. You have to understand that you cannot miss your postnatal supplements. Iron supplement, calcium supplement, vitamin D supplements needs to be taken. If you are experiencing extensive shedding, then of course you need to get your anemia and hemoglobin levels checked, thyroid profile checked, B12 levels checked, vitamin D levels checked. Okay, you need to consider for your hair care, you have to be very mindful about how you treat your hair postpartum. You need to take care of your hair. Use sulfate free shampoo. Do not tie your hair very tight. Avoid heat styling, chemical treatments on your hair. You tend to see a lot of postpartum women, in the pregnancy, they avoid all kind of chemical treatments. Once they deliver, they start a lot of heat styling and other chemical agents on the hair. So then that is that makes your hair more prone to postpartum hair fall. Next is another tip to help in boosting circulation and also improve your follicular growth is scalp massage. Daily massage your scalp for 5 to 10 minutes, gentle circular massage. Most commonly, this postpartum hair fall, this peaks after 3 months post delivery, and by your child is 1 year old, it comes back to normal. But if you're very worried, if you feel that you're, shedding a lot of hair and it's very worrisome, it's very troubling for you, and also you're experiencing that more than 12 months has passed, but this is not reduced. You need to see a dermatologist.
I understand. Okay, so there's definitely, again, I love that you are giving like an inside out approach. It's not just about what you are putting on your hair, but it's also about what you're putting inside your body. And then what about all these products? Like, there's a lot of products out there to solve this and that problem. So, what are the products that you would recommend that somebody can invest into that are safe, can be effective as well to reduce the extent of the hair fall that women are facing?
So I would say that you should use only sulfate-free shampoo, which doesn't have phthalates and other kind of chemicals. Okay. And secondly, you should not miss your supplements: iron, calcium, vitamin D, omega-3 supplements, vitamin D. I've mentioned vitamin D, omega-3 supplements, zinc. These are very important for your hair growth and your follicular growth. If you want to, use any kind of oil, you can use essential oils for your head massage. Like rosemary oil is very good for your hair. Tea tree oil is good for your hair. So this helps with boosting your circulation in the scalp and promotes hair growth eventually.
Rajani, thank you for sharing these like inside out tips. I think that's what I'm going to call it from here on. All the tips that you're giving are inside out. You know, what to do on the inside of the body, what to do on the outside of the body to help either prevent or actually heal from these kind of like common hair and skin conditions. The third one that I want to talk to you about is pigmentation. Stretch marks, I was prepared for. Hair fall, I was prepared for. But what I was not prepared for is literally the appearance of like my face changing, the dark pigmentation in the armpits. I was like, what is happening here? It just affects your sense of confidence as well, especially if you're in the summers and you want to wear your sleeveless tops and you're just not able to. Please help us make head and tail of like, why is it that your body is changing color literally during pregnancy and after?
So hyperpigmentation is also a very common finding in pregnancy, and this again is hormonal. So as we all know, in pregnancy, the estrogen and progesterone hormones are very high. These hormones stimulate the melanocytes, and melanocytes are the cells that produce the pigment melanin, which is responsible for pigmentation and hyperpigmentation. Okay, so more melanocytes means is equal to more melanin. So in pregnancy, what happens is the already pigmented areas like the underarms, the areola, the groin area, they're already pigmented, more pigmented as compared to other parts of the body. So because of these high levels of, hormones and stimulation of the melanocytes, more melanin production, these already pigmented areas become more pigmented and hyperpigmentation occurs. Also, a lot of women will see a lot of patches on their faces. We call it melasma. This is also a very, very common thing. And I would also like to mention a few things like a lot of women may see dark, velvety patches on the nape of the skin. This also can be a very common finding in pregnancy. But if any woman develops this kind of patches over the nape of the skin, they should also get their blood sugar levels screened. It could be a sign of underlying diabetes mellitus in pregnancy. So these are a few reasons why hyperpigmentation actually occurs in pregnancy. And this is a very normal thing. You don't need to worry too much about it.
Thank you for helping us understand why is it that we get this whole challenge with hyperpigmentation is basically hormone related. But are there any treatments or remedies that you can recommend that can at least minimize the appearance of this? Because, when you do have it, it's kind of embarrassing because, like I said, it affects your self-confidence, how you dress and everything. What can we do during pregnancy to kind of minimize the appearance of this hyperpigmentation?
Never forget to use your sunscreen. In pregnancy, you should ideally use mineral sunscreen that have zinc oxide and titanium or titanium oxide. Okay, so first is this. Second is you should avoid any kind of bleaching agents on your skin, any harsh chemicals on your skin. You should avoid those. Some very commonly found stuff at home, you can try aloe vera on your skin. That's safe in pregnancy. Next, some medical ingredients which can be tried to reduce or minimize this hyperpigmentation are azelaic acid, very good for acne and pigmentation. It's safe in pregnancy. You can try niacinamide, that is an anti-inflammatory brightening agent. You can try that. That's safe in pregnancy. Vitamin C, you can try. Vitamin C serums are now widely available. You can try those. They are safe in pregnancy and it's a safe brightening agent that can be used in pregnancy. So these are a few ingredients that can be used that are safe in pregnancy.
That makes complete sense. And were there any products that you yourself tried when you were pregnant that kind of cruised you through this journey of maintaining your beautiful skin?
So yeah, there's one brand in India that's Rinie. They make products that are safe in pregnancy and breastfeeding. The products are tailored only for pregnant and breastfeeding women. So you can check their website. They have a lot of variety of vitamin C serums, non-salicylic acid, face cleansers, and the body butter is also quite good. They have a mineral sunscreen that doesn't leave a white cast, like all mineral sunscreens do. So that is one good product. So yeah, Rinie is a brand because it becomes easier for all pregnant women just to visit one website and they know that all the products are pregnancy and breastfeeding safe. So they don't really need to check the ingredients in every product they buy. I've also tried their products while I was pregnant and I've also gifted my friends products from them who are pregnant. If any woman who wants specifically tailored products that are only to be used in pregnancy or breastfeeding, they can definitely try products from them.
My God, that is very helpful to know that there is a brand that is literally catered to pregnant and breastfeeding women. It just gives you that peace of mind of picking the things that you need from whatever they have to fulfill your skincare needs. One ingredient that I keep hearing about that you shouldn't use during pregnancy is retinol. Know that now most of the women are giving birth after the age of 30. And after the age of 30, most women have also started some kind of anti-aging skincare routine, and retinol is a big part of it. So why is it that retinol should be avoided during pregnancy and post-pregnancy as well, like when you're breastfeeding?
Retinoids are contraindicated in pregnancy. It's a strict no to be used in pregnancy because they are teratogenic. Studies have said that they have caused birth defect in the fetus. So it's a strict no to be used in pregnancy. Retinoids, either topical or oral, has to be avoided in pregnancy. So yes, retinoids are not safe in pregnancy and you should avoid it. Also, the anti-aging creams, as you said, they have a lot of, the main ingredient is retinoids. So while you're pregnant, it's always advisable to not use such creams. And yes, check for the ingredients. If it has retinol, it's a strict no.
Wow. I cannot imagine something that you're putting on your face that can be absorbed into your skin and actually cause a birth defect. That is something that is so important for women to know, to actually make this switch in their skincare routine. Otherwise, you could just be going on and using retinol-based products without realizing the actual impact of it. Yeah. So thank you for telling us about that. In terms of what are some other ingredients or things that, again, you can do to maintain a good skincare routine as well, even when you're pregnant?
There are a few ingredients that are safe in pregnancy and certain ingredients that are unsafe in pregnancy. We've talked already about retinoids that are unsafe. The other unsafe ingredients are hydroquinone you cannot use. You cannot use high dose salicylic acid in pregnancy. You should avoid using chemical sunscreens in pregnancy that has oxybenzones because they have been, seen to be hormone disruptors. Now talking about the safe ingredients. Now, mineral sunscreens I've already talked that has zinc oxide, titanium oxide. Those are safe in pregnancy. Now, if you want to use some moisturizers, ceramides and peptides are safe. Hyaluronic acid, as we talked in stretch marks, meant for hydration, it's safe in pregnancy. Then you can also, if you want to go for peels, you can try glycolic acid or lactic acid, low percentage lactic acid or glycolic acid peels. Then if you have acne or hyperpigmentation, azelaic acid, niacinamide, vitamin C is safe in pregnancy. So these are a few ingredients that you need to check. These are the safe and these are the unsafe, and you need to check your skincare products before buying them while you need to use it in pregnancy and breastfeed.
My God, like I just feel that like you're a gynecologist, but you're like this crossover between a gynecologist and a dermatologist
Yeah.
because you have such a wonderful and extensive knowledge about all of these things. And I'm so glad that you're here to educate women about this because, see, at the end of the day, like I said, all women have these questions. And what we are doing is that we are doing Googling. And Google, as we know it, is this vast source of information, but also of misinformation. You don't always know who to trust and what to trust. And most of us are not comfortable asking our own gynecologist, or they might not even have the information to offer us because that may not be an area of interest or expertise. But Dr. Chandni, you are a gem, and I'm so glad that we have you here to teach us about all of these things.
Because really, I'm a mom as well, you know. I have been pregnant, so I really know. I've done my research. I've gone through all of this. I know because when I was pregnant, I was very, very, worried about developing hyperpigmentation, and because the more you know, the more scared you are, right? So I was actually very scared and I was very mindful about what I was using in my hair, in my skin during my pregnancy. So this is all my research and these are the products since I've been a mom. So I can tell you about this. Yeah. It's
I
not only
love
about
that. You're coming from not just like your professional experience, but your personal experience as well. And how often would you come across a doctor who is able to offer both of these? So we're so lucky to have you on this podcast.
thank
Dr.
you.
Chandni, is there any other one last tip or something that you would like to tell moms to embrace their mom bod and all these changes that they go through in their hair, skin, body during pregnancy and after pregnancy?
I would really like to tell all the moms that this hyperpigmentation, stretch marks, acne, everything is only a normal maternal adaptation to pregnancy. You should actually embrace all of it. These all are going to be temporary. You will regain everything once you deliver your child. Your body has made a human being, and that's something you should be proud of. You should, carry your tiger stripes, as I already said. You should never body shame yourself and never let others body shame you, because you've done something miraculous, I would say. And you
How
should actually.
lovely. How lovely. That is such a wonderful last message to leave our audience with. Dr. Chandni, I just want to thank you for joining on this episode. I want to tell all the listeners, if you enjoyed the information that you got here, please do subscribe and follow our channel for more such amazing educational content on parenting, and not just about parenting regarding to your child, but even for yourself. And we are so glad to have you here.
Thank you for inviting.